Good morning, good evening, good afternoon from wherever you are. Would like to apologize for the delay in starting this discussion. We've had some issues with the internet, and due to that, Honorable Dr. Victoria will be off camera for this session, but we hope to be able to answer as many questions as we can regarding our current topic. My name is Dr. Anne Peter Lomole, and I will be the moderator for this session. Thank you so much for joining us on the South Sudanese Women Intellectuals Forum. Today, on our special edition, we'll be discussing the status of healthcare in South Sudan, the challenges and opportunities available. And we are honored to be joined today by Honorable Dr. Victoria, the Undersecretary of the Ministry of Health. We will be looking at the overall status of the healthcare system in South Sudan, the challenges and the opportunities. And before I get into the discussion, I would like to briefly introduce Honorable Dr. Victoria. So Honorable Dr. Victoria Majur has had a long career in public service and in clinical health service provision. She is the current Undersecretary for the National Ministry of Health in South Sudan. She has also served at the Ministry of Health in various capacities, including as the Director for the HIV/AIDS STI Department and the Blood Transfusion Services. Prior to this, she worked in Australia for a few years before coming back to the country in 2012. She's a member of the Australia Society for HIV Medicine and is also a member of the Technical Advisory Committee for the African Society for Care of Children Living with HIV. She's also a former board member of the board directors for South Sudan Broadcasting Corporation and has been involved in various health education programs on the same network. And she is a member of the South Sudan General Medical Council and an advocate of women and girls' rights. She was also a finalist in the Irene Krestav Award, which is an Australian award that is given to refugee women who have had a major impact and have contributed significantly to their communities. She has extensive experience in both clinical and policy fields, and we are honored to have her on this special edition. Dr. Victoria, thank you so much for joining us and welcome.
Thank you, Dr. Anne, and I really want to thank South Sudan Women Intellectuals Forum for giving me another opportunity. This is my third time to be in the forum discussing a topic, so I just want to say thank you for giving me the opportunity.
Thank you so much, Honorable Dr. Victoria. You have been of great support to the South Sudanese Women Intellectuals Forum, and we are privileged to have you here today for the first time in your capacity as the Undersecretary for the Ministry of Health. We would also like to thank our audience for joining us today, and we would like to encourage you to send in your questions. Questions have already started coming in from the audience, and you can post your questions on our Facebook page under the live stream. We are also currently streaming live on YouTube. We will try and answer as many as we can, and we would ask you to share and feel free to share this discussion on all your social media platforms. And Honorable Dr. Victoria, I think we'll just go straight into the questions because I know you have a very tight schedule and we want to get as much information in as possible. So in terms of, we'll talk a bit about some of the mandate of the Ministry of Health. And the first question I would like to ask you is about human resources. So South Sudan human resource for health has been a chronic issue in terms of numbers and training, with statistics as far back as 2013 showing that South Sudan has about 1.5 doctors and 2 nurses for every 100,000 citizens. The human resource deficit has been seen to extend to even the planning, policy, and oversight functions of the Ministry of Health. And there have been complaints that capable and dedicated individuals are overburdened and demoralized as they have found themselves unsupported and overseen by people who are less qualified than them. Now, my question is, how successful has the ministry been in carrying out its mandate in realizing the vision of having South Sudanese health professionals in a ministry that is well trained and well equipped and which will sustain conditions in the country that enable economic growth, stability, democracy, and national unity? How successful has the ministry been in terms of building capacity and ensuring that our healthcare facilities are well equipped? Dr. Victoria.
Thank you. And human resource for health has been one of the biggest challenge for the ministry. The ministry's mandate, as you already put it, is policy formulation and shaping, providing quality health services for the people of South Sudan, including human resource for health.
Yes.
Uh, Over the past few years, the Ministry of Health did manage to train a number of doctors, postgraduate training in Egypt, in some part of East Africa, Kenya, Uganda, Tanzania, and as well as Ethiopia. The Ethiopian scholarship program has been very successful. We have so far received more than 50 doctors in postgraduate training over the past few years, and many of them are working in Juba Teaching Hospital. Also, the ministry have tried its best to invest in health science institute that train mid-level cadre, and these health science institutes have been spread across the 10 states, and it has graduated a number of nurses, midwives, and clinical officers, and also lab technicians. In a recent launch of the South Sudan Lab Professionals Union, they registered more than 3,000 lab professionals, which is a milestone. Also, the number of midwives have increased significantly over the past few years due to the health science institutes. We have doctors of various specialties at the moment: orthopedic surgeons, we have gynecologists, we have physicians, pediatricians, and even subspecialties like ENT and dermatology. Although there still remain a challenge of some of the specialties like anesthesia and other subspecialties like neurosurgery, but we have a number of doctors that have been trained, and the Ministry of Health have done its best to make sure that doctors are trained. And currently, we have also recently examined 78 doctors for the Ethiopian scholarship, and 30 of them are going to go early next year to Ethiopia to study various specialties as well. So the ministry is still trying its best, despite the brain drain, and many of those who we train are outside the country because of issues of motivation. And we're hoping that the government will look into issues of motivation, improving staff salaries, which is also being handled at the moment by the Ministry of Public Service and by the hopefully in the next sitting of Parliament, it's going to be passed, and improving salaries of doctors is the way forward. But in terms of human resource for health, we have done significantly well over the past few years. Retention is the problem.
Yeah, I'd like you to expound a bit on that, because there's been a concern that the Ministry of Health has trained quite a number of subspecialists in the region, especially in East Africa and Ethiopia. However, once people graduate, many people are not coming back because of what you're saying in terms of the fact that they're not being paid, they're unable to sustain their families from what the ministry is able to offer them. So, what other strategies is the Ministry of Health using in getting, especially the diaspora workforce, back? As you have many people who are qualified, but they're working outside the country. What incentives can be given for those who may want to work in the country to make that option attractive? And how sustainable do you think these strategies, or successful these strategies might be, to get the diaspora workforce back into the country?
The Ministry of Health has tried over the years to advocate for increase of the salary, but unfortunately, this is beyond the Ministry of Health. It's a national issue. The teachers are also trying. The other civil servants are also trying to increase their salary. There've been an outcry outside there, and luckily the university lecturers managed to get their pay increase, although not to that extent, but at least they're better than the other civil servants. And the budget for health for the past few years was less than 1%. So that can barely pay salaries, leave alone providing services. So it's a national thing. It is beyond the Ministry of Health, and the government as a whole need to work towards it. There have been a couple of proposals by the Sud Institute and Juba University. There's a proposal by Public Service to increase the salaries and make a good package. Also, allowances have not been paid in the past in the Ministry of Health, such as infection allowance, dressing allowance, as well as risk allowance and hardship allowance for those who work in the outside outside in the states, in the rural areas. So in this upcoming budget, which is 10%, hopefully we're looking into putting more emphasis on improving retention packages for doctors, especially those who work in the states. For those who work in primary healthcare and in state hospitals, at least the implementing partners are supporting with incentive, which is not that bad compared to those who are here in the city. So they get incentive with our partners. Unfortunately, there've been this harmonized salary scale that was used in the past, that has harmonized the salary, giving a minimum incentive to all the doctors and nurses working in the state level, and that has demoralized many of our healthcare workers, and they've left. So we're depending on our partners to give incentive to those who work in the rural areas, as well as even in some programs in the ministry, like the Global Fund supported programs and the PEFA supported programs, are also given incentive to make them stay and to make the retention there, and to allow them to stay in the programs, and also to yield results, and be able to sustain those donor supported programs. As like I said, the Ministry of Health will continue to push, and the advocacy should not be left only to the Ministry of Health. The civil society organizations, even doctors in diaspora, should also join in the advocacy, so that we are able to push our government to do better and make a better living condition and better work environment for our doctors to stay in the job.
Thank you for that, for answering that question, Dr. Victoria. You have indicated that to some extent the Ministry of Health depends on the implementing partners to support paying of salary scales. But the question many people are asking is, how sustainable is this in the long run? In essence, the fact that we are slowly moving from an emergency relief setup towards a more sustainable development one. So how are we going to handle the transition, where now we move from our partners assisting in incentivizing our healthcare workers to the Ministry of Health actually taking responsibility for it?
Sustainability is a worry of all of us, including our partners, and most of the partners have now stopped paying incentive. In fact, there is a donor fatigue, and most of the partners are refusing any proposal that contains incentive. The word incentive has become like a, it kind of like causing allergic reaction to our donors, and the donors don't like to hear the word incentive anymore. And I can't blame them, because it's not the responsibility of our donors to pay us incentive. It is the responsibility of the government. And we have an example of recently the COVID response. We've been having a challenge that during the response we have recruited a number of volunteers in the COVID response in various areas in COVID response, like the Emergency Operation Center. And when the response went down, most of the donors were not able to pay the incentive, and that has caused us a bit of hassle. And we were forced to make radical decisions, like downsizing those volunteers, and perhaps sending them back to the mainstream and to the rest of the departments of the ministry, because we could not maintain them in the EOC in the COVID response. So it's a food for thought for the government to really think about ways of improving the system, ways of sustaining the system, and not depending on the donors. It will take a while. I will not say that it just will happen overnight. It's a process. It needs a lot of work. It needs a lot of advocacy, and needs political will from the government to be able to improve the salaries, so that we have sustainability, because our donors will not continue to pay incentive for us for a long time, as they're already showing symptoms of donor fatigue.
So what are some of these strategies that the Ministry of Health has thought about? Because I would assume that this is something that you're constantly in discussion about. What are some of these strategies that the Ministry of Health is trying to set up to ensure that they're able to eventually take over healthcare provision in the country when the NGOs pull out, as they have sometimes done, and in order to ensure that the quality of healthcare is still maintained despite that transition occurring?
Domestic financing is very important. Domestic financing should be the way to go. We need to keep improving the budget for health. 1% was not enough, and 10%, I will say, is still not enough. It will not be able to cover for everything. So pushing the budget for health to more than that would be the best way to go. Improving the salaries of civil servants, including doctors and nurses and midwives, is the way to go. Again, it's not the issue of Ministry of Health alone. It also requires the whole government at a higher level to think about improving the salaries of the doctors and nurses and all the health cadre, plus the other civil servants, so that we have a resilient and robust healthcare system. Without a good salary package, we will not be able to have a good, robust healthcare system, because we'll continue to have the brain drain. Doctors will continue to graduate and stay in East Africa or where they trained. Healthcare workers will continue to join NGO sector and private sector, and the public sector will remain weak as it is.
Thank you, Dr. Victoria. It definitely is a systemic problem that will involve many different decisions at other levels of government, including the Ministry of Finance and income generating activities related to how the country is able to collect revenue. Now, the other issue that most healthcare professionals have faced in the country involves security for medical personnel, which has been an issue in various regions of South Sudan. And we have actually experienced deaths of healthcare professionals in various regions of the country because of lack of security and tribalism. So, what is the ministry doing to investigate some of these crimes and to ensure that this does not continue to happen?
The ministry have raised the concern with the relevant stakeholders, and the ministry has denounced this act against healthcare workers. We've lost a number of healthcare workers in Lake State, in Upper Nile State, and different other states. I was in a funeral of one of our colleagues that lost his life in Upper Nile way back 1 month ago back, Dr. Pitia. It was really heartbreaking seeing the family devastated. It's a loss to the family and to the medical fraternity. And the Ministry of Health, of course, denounced that kind of act. And we believe that the security agents need to do a lot of work. The states need to do a lot of work as well, because at times some of our colleagues have lost their lives, and the state does not even bother to talk about it, or even to raise these concerns. We had a leadership and governance forum under the auspice of Honorable Minister Elizabeth Echway, 2 months back, and that meeting was these things were discussed, and it was brought up in the communique by the ministers that they have to commit to make sure that they're protecting the healthcare workers who go beyond the capital city of Juba to go and work in those places. Because the reason they go there is not because of money. It's a call. They want to provide service. They are humanitarian workers. They work under difficult conditions, and the state has a role to play in protecting the healthcare workers and everybody in that state. It's a responsibility of the state, first of all, where they work, and also the Ministry of Health in that state also need to play a role. Investigating those crimes is also paramount. The Ministry of Health, Doctors Union, and other stakeholders have been really vocal on that. A number of meetings have been done, and the Doctors Union is following up on these kind of activities that has happened. In fact, they have formed an umbrella body called Health Professionals Forum, Health Professionals Council, that has all the other nurses and midwives, because that's not only for doctors, but it has been observed that it is happening across the board to all the healthcare workers. So the Ministry of Health continue to push the relevant stakeholders to investigate those crimes and put those criminals to books.
Thank you for that answer, Dr. Victoria. Unfortunately, because of the recurrent issues associated with security, then most of our colleagues and most of the healthcare workers are very they're very resistant to actually going to areas where they don't come from, because this is a problem that starts at the roots of sometimes even tribalism, and it's quite unfortunate. And I think sensitization of our communities about the role of healthcare workers in terms of provision of services that crosses across borders and across tribes should actually be emphasized on. So the discussion starts at community level, because if the attitude of people does not change, then we are not doing much, even if these relevant government organs that you're talking about do their work. If the attitude does not change, then we're still in big trouble. Thank you so much for that answer, Honorable
I
Dr.
totally,
Victoria.
I totally agree with you, Dr. Anne, and I think our leaders and our community leaders and also opinion leaders need to play a big role in that. The advocacy should come down at the grassroots. We need to educate our people in those other states that healthcare workers don't have tribes, they don't have religion. You can be treated by a healthcare worker from any tribe, from any religious background. They don't have a tribe, they don't have a religion. They can provide, they are only humanitarian workers. There are people who want to provide service to anyone. So that message needs to be loud and clear, and people need to understand that healthcare workers can work in any part of the country and they need to be respected and be given security and a conducive environment to serve the lives of people.
I agree, Dr. Victoria. I will continue to the next question, and this one mainly involves funding and some of the key achievements of the ministry. So donor funding continues to be pumped into South Sudan in billions of dollars, and the utilization of this funding has been marred by corruption scandals that have been made worse by lack of functioning systems of accountability. Not much has been seen in the ground in terms of development and improvement of healthcare services in the country, leading to donor mistrust and in extreme cases, actually donors pulling out in terms of funding and support for the various sectors of government and even the Ministry of Health. So, what are some of these, in view of the kind of funding that has been poured into the country? What are some of the key achievements of the Ministry of Health to date, and what is the ministry doing to ensure that corruption is minimized and that functioning systems of accountability are put in place for the kind of funds we're receiving?
Thank you. And as much as donors talk about corruption, as well, the donors have also their own issues because nowadays, because of on pretext of corruption, donors have decided to use uh, some policies. Like, for example, the Ministry of Health is supported by the Global Fund. The Global Fund doesn't give money to the Ministry of Health. The money is given to a principal recipient, and they have some policies like the zero cash policy. That zero cash policy doesn't allow the Global Fund to give any single coin to the Ministry of Health. The money is given to a principal recipient, and the principal recipient gives it to a sub-recipient, the Ministry of Health being one of the sub-recipients, and that money is controlled to the point that there is no any corruption happening. And unfortunately, in that process, the money trickling down to the Ministry of Health is very, very small amount because the bulk of the money goes on grant management. It goes on, on these principal recipients and the sub-recipients, and most of them are international agencies. So because of that, the money ending up going to the Ministry of Health is very small. However, it's also worth noting that we have done some achievements with the Global Fund supported programs such as HIV and malaria and TB. We have developed a number of facilities through from that grant. We have expanded the HIV service, and we receive free malaria drug from that fund. We also procure anti-tuberculosis drugs and HIV drugs, ARVs, and the HIV program has significantly expanded over the years. We have come a long way from a prevention of mother-child transmission coverage of 11% to now almost 60%. So that's an achievement. We've also expanded services, decentralizing services from having only the state hospitals offering services to now primary health care centers. From 22 in 2014, we are now expanded to almost over 100 facilities offering HIV. And we're even doing HIV in private facilities. So that's an achievement. The Emergency Operation Center, supported by our donors, is an example of a success of the Ministry of Health. In the past, we did not have an EOC unit, but now we have a functional public health emergency operation center, well equipped, human resources there. People have been trained, capacity has been developed, and even we have some of our staff who have left now, and some of the staff are working with Africa CDC in other parts of the region. So that shows that they have capacity. They moved out of South Sudan, and now they're working in those countries. So the EOC is able to manage emergencies. We have a robust system of surveillance, and the public health laboratory has been well equipped with a number of, with PCR machines, a number of gene expert machines, and now with COVID also, we were able to get to secure a bit of infrastructure to combat COVID. The PCR machine has been sent also to WOW. We have a PCR in Numule. And now through the IGAD funding, we're also able to get PCRs at the border towns of Reng and Awil and Nadapal. So a lot has happened with the donor money, despite the fact that people talk about corruption. And we've also were able to to do a second floor of the Emergency Operation Center from the African Development Bank funding. We now have a oxygen production plan in the country based in Juba to cater for the whole of Greater Equatoria, and we have received another oxygen plant that's going to be posted in Western Bahr Ghazal to cater for the Greater Bahr Ghazal. So we have come a long way. We have come a long way. We are able to test to check. The only thing we're not able to do is genomic sequencing. We're still sending samples to Uganda to do genomic sequencing, but we're expecting also support to have the infrastructure in place and to be able to test to check for genomic sequencing in the country. So through donor money, despite the issues of corruption being raised, the Ministry of Health have managed to have some achievement in place done through the donor funding. And there is no any way for corruption because most of the donor money doesn't come to the Ministry of Health. It comes through partners or come through projects. So there is no way the Ministry of Health could do, there's no way to say that there is corruption in that funding at all.
Thank you, Dr. Victoria. You talked a little bit about the COVID-19 response in South Sudan. Could you just give us a brief overview of what the status currently is of the pandemic and the response in South Sudan, and what are some of the issues that have come up when it comes to vaccination and people being anti-vaccination, sensitizing the communities, and actually limiting the spread of the virus?
The COVID-19 has improved significantly over the past year, and it has been strengthened. There's been a lot of capacity development happening, and the response is going very well. We still have issues of testing. Most of the testing is happening among travelers, and we do have sentinel sites in the states testing through gene-expert machines, and we get results on daily basis. We have recently digitalized our COVID certificates, which is also a milestone. The Ministry of Health is using e-governance system now to digitalize COVID. All the private labs and public health lab are receiving daily COVID results. We had issues of reporting in the past. Private lab were not complying reporting. It was not easy to track the report, but now with the e-governance, it's easy to track and have a dashboard where you can see daily testing happening. The COVID-19 National Task Force last week also issued some resolution to do testing in the community and some institutions using rapid testing so that we know exactly the picture of the epidemic in the country, because having testing only through travelers and only few sporadic areas doesn't give you exact picture of the disease in the country, of the epidemic in the country. And that's why we are now doing rapid testing. The vaccination, yes, there was a vaccine hesitancy in the phase one of the AstraZeneca. When we received the AstraZeneca, there was a lot of vaccine hesitancy, conflicting information from the media. But second phase was very successful. We received 58,000 doses of AstraZeneca. And second day after receiving the shipment, we deployed all the vaccine to all the states. And before the expiry date, which was only a couple of 5 weeks, all the vaccine was done. It was given out and was used. And first week of September, we received 151,000 doses of Johnson & Johnson. And on the 8th of October, we were able to deploy the vaccine to almost all parts of the country. And people are now receiving the vaccine. And the vaccine hesitancy has improved significantly because our health promotion department, with support from UNICEF and WHO, have been doing a lot of risk communication activities, enlightening the community. The vaccination among females remains a challenge. We only have around 27% women vaccinated. People are saying that the vaccine causes infertility, but the Ministry of Health, in collaboration with UNICEF and other partners, are doing a lot of work in terms of risk communication, in terms of making awareness to our women to come out for the vaccination. So far, we have vaccinated over 1% of the community, which is so small. We are using the COVAX facility, and we have recently also written to the AVAT facility, the African Vaccine Acquisition Task Force, which is the AU facility also offering vaccination through Afra-Exim Bank. We are joining that facility as well to secure more vaccine to the people, and we are hoping by the December we'll at least vaccinate 10% of the community.
So it's great to know that quite a number of our partners and even the Ministry of Health is working on the misinformation, especially with the vaccination. However, is it true that the feeling that people are getting that there's a lot of concentration of healthcare related activities and healthcare promotion within the capital in Juba, and the rest of the states are practically being ignored? Is that something that
that,
rings
that
true
that's
or
that's
or
that's
not?
totally not in place. That's totally not in place because the Ministry of Health is now integrating COVID into existing API routine immunization system. COVID is going to be here for a long time. We don't know when is COVID going to go away, and because of issues of funding and issues of human resource, we are now integrating COVID into our API, and even with the Johnson and Johnson and second phase of AstraZeneca, the micro plans were done in the state level together with the UNICEF state offices, and the states are taking full control of deployment of the vaccine and vaccine distribution of vaccine. In our leadership and governance forum, where the DGs and the state ministers came to Juba, we put it very categorically clear that the states need to take ownership. They have to now be responsible about the vaccination, not the National Ministry of Health. So the states, when we deploy the vaccine, we deploy also risk communication messages and IEC material to be distributed. And our community mobilizers are doing a lot of work at the state level as well to make sure the vaccine is taken. In fact, in phase two, some states were calling us asking for more vaccine. So that shows that the vaccine hesitancy has improved significantly. And even at the state level, people want to take the vaccine. And the state ministries of health are doing a lot of work in that regard.
Thank you for clearing that up, Dr. Victoria. I'll go straight to the next question. Now, for many years, in various African countries, actually, human resources for health has always been an issue. And there are many different cadres that are either non-existent, few in number, or inadequately trained. There have been concerns with ghost workers who are on payroll and not providing services in their various stations. In view of this, what is the current number of healthcare professionals registered in the payroll of the ministry, and how does the ministry ensure that there are no ghost workers on the payroll who are not necessarily providing services in the various areas that they have been assigned to?
We have recently conducted a screening at Juba Teaching Hospital to ascertain the number of healthcare workers because we wanted to avoid this issue of ghost names. And we have also started issuing identification cards to the doctors and nurses and all the staff at Juba Teaching Hospital. We have registered over 700 staff, both clinical and non-clinical, and including in unclassified staff. And we're yet continuing with the exercise. The Ministry of Health as well has conducted screening to say physical screening to see that people who are working in the ministry don't have ghost names, but they're the people who come. And every month we also do a screening. And I think the Ministry of Public Service is also doing this electronic payroll system, and that will help us avoid issues of ghost name. And the ministries have a role to play. Not only Ministry of Health, but all the other ministries need to screen on monthly basis and make sure that the people who are paid are the right people. Despite the fact the salary being very small, still we need to make sure that we're doing the right thing and we're paying the right people. So we are working on that. We've been constantly trying to make sure that we're screening our staff. A committee has been going around, and in fact, we're even forming committees to see the states, because sometimes it's not easy for us to monitor the states. We have also national hospitals that directly go under us. With Malakal, of course, it's a different story because most of the staff of Malakal, because of the conflict that are now here, most of them working in Juba. In WA, we are constantly in collaboration with the State Ministry of Health to make sure that we don't have the post names.
So thank you so much, Dr. Victoria. You've mentioned this before, but I wanted to be a bit more clear on the issue with the chronic non-payment of salaries in the Ministry of Health. What actual plans that the Ministry of Health have in place to resolve this issue?
Unfortunately, the issue of non-payment of staff is beyond the Ministry of Health. It is beyond the Ministry of Health. It's not only an issue of Ministry of Health, it's issue of all the other ministries. And all the other ministries are addressing it. We have recently met in the Undersecretaries Forum, a forum that brings up about all the undersecretaries in the country, in all the ministries. We discuss a number of issues, including issues of salaries, delayment of salaries, and including issues of improving the salary scale for civil servants. I think the Ministry of Finance have a big role to play in that. And the ministries, the undersecretaries of the different ministries have discussed ways of remitting in the next budget, improving on the budget execution, because even if the budget has increased, execution remains always a challenge. Sometimes you have to be lining up in the Ministry of Finance for claims that ministries want to pay. And we believe that it's very important for the Ministry of Finance to remit budget of different ministries, at least on quarterly basis, so that the ministry is able to control their budget and pay their staff. That's one way to improve this kind of delayment of salaries, because the delay normally happens at the Ministry of Finance, not in the different respective ministries.
Thank you, Dr. Victoria. I really hope this is an issue that will be solved very soon, because I think one of the main reasons why many people are not actually coming back to provide services to the country, despite the fact that they have the qualifications and the experience and skills to do that, is because with no salary, with no payment, then it's very difficult for anyone to give services, even though people would actually like to give back to the country. Now, the next
I
question I
totally
have.
agree with you on that, Dr. Anne. I totally agree with you on that.
Thank you, Dr. Victoria. Now, the other question that I have for you is related to an incident in Juba Teaching Hospital. The political situation in South Sudan does not allow for much freedom in taking industrial action by workers, let alone healthcare workers. And as such, many healthcare cadres have been unable to put their discontent and demands across due to fear of being targeted. However, recently, healthcare workers undertook industrial action in Juba Teaching Hospital, and they raised some genuine concerns, including issues with availability of accommodation, the payment of incentives, hospital security, and their personal security. We've all had those stories of healthcare workers being threatened at gunpoint as they provide services, and others being murdered in cold blood. We had discussed that a few minutes ago. So what is the ministry doing about this, and how will the ministry ensure solutions are found for these issues? And what is the ministry doing to open channels of communication between the ministry and the different healthcare cadres, so that they're not forced to use industrial action or the threat of nationwide strikes to get their demands heard?
Well, the issue of Juba Teaching Hospital that recently happened, the demands are genuine demands. I do agree with you. And they're being addressed as we go, because, as you know, things don't happen overnight. There are immediate things that can be done. There are immediate term actions and there are long term actions. In regards to the demands of the house officers, they were demanding accommodation, and the accommodation was being addressed. We formed the committee that screened the doctor's mace, and we gave a notice of vacation to many of those who are living there. Unfortunately, some of our colleagues decided to not to listen, and they're still staying in the mess. After the strike, we also formed another committee, and the committee include even a member of the house officers, and one representative of the medical officers to follow up on the maze. The maze capacity is almost 69 people, and we found that only 20 out of those 69 were eligible to live in the maze. So we have issued for them ID cards for entrance, and we are working on it to make sure that people who are not eligible are getting out of the maze, and the people who are eligible, like the house officers, should get in the maze. The house officers since 2012 have not been in the system. They have not been given employment. On our side, as ministry, we are doing screening for them, like I said earlier. We've issued them with ID cards, and we're going to give them provisional appointments, giving them contracts until the budget is approved, and then they get transitioned into the nominal role. We've also been working on a well-structured internship program that is tailored towards excellence and towards quality teaching, so that the consultants are able to at the end of the internship program, produce doctors that can be relied on, that are capable, that have the skills necessary to carry out and execute functions in different facilities in the country. The housemanship program is a 16 months program, and unfortunately, over the past few years, house officers were not paid. and they were only paid incentive from the cost sharing which is generated by the hospital. But unfortunately, even that cost sharing, they have not received it for 2 months. So their demands were genuine and they were not addressed, and they were purely administrative issues that could have been handled and would have been, save us the hassle of entering into industrial action that has happened. The line was open between us and the house officers. We've been discussing with them. However, sometimes things get out of hand, and we just have to continue. We have formed a crisis management committee that is dealing with this at Juba Teaching Hospital to arrest any early arising crisis in future, God forbid. But the demands of the house officers were, some of them were tackled, some of them were, things beyond us all, and we just have to work on them, and we just have to open that kind of dialogue with the house officers and all the other healthcare professionals in the hospital. And sometimes things are beyond the Ministry of Health, because issues of COVID allowance also was the Ministry of Finance issue. It was delayed at the Ministry of Finance. It was not paid out. So the Ministry of Health tried to follow up those COVID allowances, and eventually we got the COVID allowances, and hopefully by next week we'll be able to pay the house officers and all the other people who were waiting for the COVID allowances. So sometimes things are beyond Ministry of Health and beyond the capacity of those who are in charge in the ministry.
So you've mentioned a lot about some of the other ministries actually having a role to play in terms of the challenges that the Ministry of Health is facing. When it comes to intersectoral collaboration within government sectors, which of these government sectors are collaborating with the Ministry of Health to ensure that health service provision, especially in hard to reach areas, is actually implemented? And how is the ministry working in collaboration with these various sectors to ensure health provision for South Sudanese citizens, taking into account the current humanitarian crisis, including the floods and insecurity? And what are some of these challenges that the Ministry of Health has encountered in trying to foster this collaborative effort? What are some of your recommendations when it comes to
We've
that?
been collaborating with the Ministry of Public Service and Ministry of Labor, and actually these two ministries are working with us very well. We have not experienced any challenges with them. The Ministry of Public Service has supported the screening program of removing ghost names, and they have also been working with us in issues of improving salaries of the staff. I have not encountered any issues with these two ministries. Of course, the Ministry of Interior and also the state governments also are stakeholders in this issue of ensuring the safety and security of healthcare workers at the state level is directly responsibility of the states. So the states governments also and the state ministries of health also need to liaise with the state governments to make sure that there is safety and security for healthcare workers who work down there.
So basically, most of the issues with intersectoral collaboration in terms of advancing the mandate of the Ministry of Health is associated with the Ministry of Finance, and I hope that is something that
it is definitely Ministry of Finance and Ministry of Public Service and the Ministry of Labor, because we have recently met with the Ministry of Public Service regarding the issue of housemanship and how to improve the housemanship and how to put a budget, a annual budget for the house officers, because the house officers over the first few years have not been in the system since 2012. They've just been working voluntarily with no pay, and nowhere in the world this can happen. I mean, house officers need to be, they're a workforce as well. They're supporting the hospital. They need to be looked after. And most of the teaching hospital has house officers who support the work in it. So there should be an allocation of specific budget for housemanship, and also liaising with different universities and medical schools to ascertain and forecast the number of medical graduates every year, so that we are able to regulate and organize the housemanship program by cycle, from like an annual cycle of.
Thank you, Honorable Dr. Victoria. I hope we have not lost you there. Are you still with us? You're not very clear, Dr. Victoria. Dr. Victoria, if you can hear me, we're not getting you. I think there must be a problem with the network connection.
I lost the connection. I've lost the connection, but I'm back.
Go ahead. Please go ahead.
Yeah, I was talking about the issue of the liaising with the public service and Ministry of Finance to allocate an annual budget for training of house officers, and also coordinating with different medical schools to forecast the number of medical graduates that will be graduating on annual basis, so that the housemanship is more organized and happening in cycles like all other countries.
Yeah, it's quite unfortunate that housemanship in South Sudan is currently not a paid position, and I hope that is something that is sorted as soon as possible, because it's quite unfair to expect our young colleagues to work, especially in the current state of our country, without pay. Now, I'll go ahead to something that happened currently in terms of current affairs. We have seen videos circulating in different media outlets about an incident that happened in Western Equatoria State at a girls' school called Iba Girls, and there has been a lot of conflicting information as to what might have transpired, with many public health experts fearing that this will lead to more mistrust in the healthcare system in South Sudan and in the Ministry of Health, and might set a precedence for refusal of public health interventions. In this case, this was mass chemotherapy, including vaccines. It might even extend to vaccines. And this might spell doom for our already weak healthcare systems. Can you tell us exactly what happened and how did the drugs get there? Whether the people who were administering this medication were trained, and what steps the government will take the next time, the Ministry of Health specifically, to ensure that this problem does not occur again and prevent the spiral of misinformation that occurred with this incident.
It's very unfortunate, and that this issue of the Iba girls went out of hand, and the media played a very negative role in it. And it was also unfortunate for to post photos of young girls in hospital, breaching the confidentiality and privacy of those young patients. It was very unfortunate. What happened is there was a mass drug administration campaign happening, organized by the Ministry of Health in collaboration with Ministry of Education and World Health Organization. It actually was not a vaccine as said by many media houses. It was a drug, praziquantel, a drug used for treatment of schistosomiasis. And there was a national training in Juba, supported by WHO, where TOT training of trainees was done, and national supervisors selected. The national supervisor went to the states, and also there were state supervisors, county supervisors, and Payam supervisors. Some of the states targeted were Eastern Equatoria, three counties, I think, in Eastern Equatoria, and some counties of Western Equatoria, plus one county of Western Bahar Ghazal. It looks like there is a group working on the report, and the report is not yet out. It's going to be published and will show exactly what happened. But preliminary results there might have been lack of enough social mobilization. Social mobilization was not done adequately, perhaps because the students and the families were not well informed about the campaign and about the drug and side effects of the drug. Secondly, the drug was also taken on empty stomach, and that might have contributed to the side effects of including dizziness and stomach pain. And as a health personnel, you know that praziquantel causes abdominal pain and nausea and vomiting, as well as dizziness, and especially if there is a lot of infestation of the intestinal schistosomiasis, that would be even more. And there was an element of psychomotor elements as well in the video, as seen by I think most of healthcare professionals will detect the psychomotor symptoms immediately in the video. But then it went viral and it was misinterpreted, and the media played a negative role in it. And the Ministry of Health organized a team of experts, epidemiologists, a physician, and a pharmacist. I went with them on the ground. We did an assessment, and the report is being compiled. Unfortunately, some of the data were not available, like the height measurements, and the county health department, the records were not were taken away and were in custody of law enforcement agencies, perhaps the county authorities, and we did not have access to it. That's why the report was delayed. The drug is from a company called Merck's, a credible, reputable American company. Expiry date is next year, July 2022. And so far, the group is still working on the report, and the report will be made available as soon as possible.
Thank you so much for clarifying that issue, Honorable Dr. Victoria. I think what most of us were concerned about was whether the community was actually prepared for this mass administration and whether they were given the information. And from what you have said, is that that did not happen. And I hope that
it, it,
going
it,
forward,
it, it might have happened, but not adequately enough to give them enough information. Because from what we have observed, people were very negative and thinking that their children have been poisoned. So that shows that the social mobilization at the county level and at the grassroots level was not done adequately, because we had similar exercise in Monvolo that went smoothly well and very successful, and was done properly, and there was not even a single complaint from Monvolo. So that shows the two different counties where this exercise was done. Unfortunately, we were obliged to put the campaign on hold. We put the campaign on hold until this event unfold, and in future we'll have to make sure that there's enough social mobilization in place, and people have been really adequately informed and trained. And I think also the county health department have a big role to play in that, because at the national level it's very difficult to supervise all the states and county, and that's why capacity building at the state level is very important. Having autonomy, taking the ownership of programs organized at the National Ministry of Health is very important. The states have a big role to play in supervising and making sure that these things should not happen. Yes, the National Ministry provide oversight and provide technical support and leadership, but the state also have a big role to play in making sure that these kind of campaigns in future are successful, and also making sure that community mobilizers and opinion leaders are involved and totally involved in the process.
yes, I'm glad you emphasized the role of the state ministries of health in taking up leadership for health within their states, but also the fact that the Ministry of Health in the central government should not completely relegate that responsibility to the state ministries because of its leadership and supervisory role in terms of ensuring that the healthcare sector is well established and is able to provide services in each and every sector of this country. Now, does the in view of what happened with the IBA girls, does the state have a policy in terms of collecting information on drug reactions related to, or even vaccine reactions related to such public health interventions? Is it something that's established, like there's a reporting system for this, so that the media doesn't have to take that kind of responsibility to be the one to now disseminate information on things that are happening that are related to healthcare? Dr. Victoria, are you still with us?
Yes, Dr. Anne. I'm saying there is a system. A pharmacovigilance training was done recently at national and also state level. There was a pharmacovigilance training done, and we are establishing a system of pharmacovigilance. And also, there is a national committee for adverse drug reaction that has a number of experts recently established with support from WHO, and is replicated at the state level, because the medical personnel at the state level have been sensitized to report any adverse drug reaction, especially with vaccinations, especially with this era of COVID, to report so that they're handled. And at the national level here, we have national vaccine supervisors, that are medical doctors that are on standby in the facilities, just in case if there is any emergency.
Sorry, Dr. Victoria, we have lost you a bit there. I don't know if you can just
Unfortunately,
yes, please go ahead.
Unfortunately, with the situation of IBA is a county, and it has a primary health care. So the personnel working there was on his own, and we were even obliged to bring doctors from Yambio to come and reinforce and support the facility, because the facility was overwhelmed. It is a primary healthcare center, and most of the students were transferred to Meridi. And Meridi is a bit of a way, and also the road was bad, especially given the rainy season. So issues of accessibility to health service remains a challenge in South Sudan in some of the states, and also issues of human resource, as we discussed earlier in the program.
Thank you, Dr. Victoria, for clarifying the situation in terms of the events that happened at Iba Girls. Now we'll shift a little bit and discuss about women in the Ministry of Health, because of course this is a platform for women, despite the fact that we discuss quite a number of issues affecting our country. How many women do we currently have in the healthcare sector? Does the ministry have these statistics? And what are some of the challenges that have been faced by women working in the healthcare sector? And what are some of the solutions for these challenges?
In the Ministry of Health, the Director General, there's only one female Director General. In fact, she's the most senior in the ministry, and she's the first Director General that was appointed before. Some of them have left and joined other places. There's a number of other senior staff, directors and program managers and senior inspectors. In the hospital, there is a number of consultants. We have a physician, we have 4 or 5 gynecologists, we have a number of
Dr. Victoria,
on
I
our
think
site as the Ministry of Health.
Go ahead. I think you're cutting off a bit there.
Yeah, the network is bad. I'm saying we do have a fair number of females at the Ministry of Health, and also consultants and registrars and medical officers in the different various hospitals. I've not encountered any issues with being a female in those positions. I don't know about those who are working in clinical setting, but on our side as policymakers, we've been contributing to the Ministry of Health and doing our best we can in the ministry.
In various sectors, there has been a trend to undermine women in decision-making positions because of this culture of um, looking at women as people who can contribute in terms of leadership. Is this something that you may have experienced in the various dockets that you have occupied or have had reports about?
I did experience some of those, but I will say it's personality thing, not from everybody. Perhaps it's just a personality thing, and normally with personality things, you don't take it serious. You just ignore it and just move on with life and do what you can.
Thank you, Honorable Dr. Victoria. What steps have been initiated thus far to implement affirmative action in the Ministry of Health and in the healthcare sector?
It's unfortunate that the affirmative action doesn't normally count in this kind of institution, especially in a sector like the health. You're a health professional. It also depends on seniority, it depends on scale, it depends on expertise, it depends on your skills. So sometimes it's not easy to do the affirmative action in sectors like the health sector. And I also believe that people should be treated based on merits. And there are sectors where the affirmative action sometimes doesn't necessarily get implemented or succeed.
That's quite unfortunate because I believe that quite a number of our medics and women have a lot to offer in the Ministry of Health, and I don't think it's something to do with skill really or experience, but it's possible that is it possible that the setup is geared towards disadvantaging women when it comes to positions where they can actually significantly impact in terms of planning, not necessarily the clinical areas. Dr. Victoria, I'm not sure whether you're on mute or it's the internet failing us again. Honorable Dr. Victoria, we seem to have lost you there. Okay, we seem to have lost Honorable Dr. Victoria. She's having some internet issues in Juba right now, and I hope we can get her back. Aisha, if you can please sort of reach out to Dr. Victoria and see whether we can get her back. But I just want to basically reiterate to our audience that We are really grateful to have Honorable Dr. Victoria on the session today, and I think she has done quite a good job in explaining some of the issues that we have in terms of healthcare in South Sudan. I hope that our audience is sending in questions. We have received a few which Honorable Dr. Victoria has been able to answer, and we hope to be able to clarify most of these issues. In case we are unable to answer some of those questions, we will request the Honorable Undersecretary to actually give this information and to reach out to those who have concerns. Aisha, are we able to get Honorable Dr. Victoria back? Honorable Dr. Victoria? Okay, it seems that we have actually lost Honorable Dr. Victoria there, despite the fact that she's still on screen. As I wait for her to come back to the session, we know that the problems associated with the Ministry of Health have a lot to do with systemic issues in terms of the fact that our current political situation does not really allow much for sustainable development implementation, and we're still at a stage where we are focusing more about emergency relief, and therefore this has led to the healthcare sector not really being developed in terms of a sustainable system that is able to transit from dependence on donors to the Ministry of Health actually taking full and complete responsibility for the healthcare sector in South Sudan. We have also had a lot of issues with human resources in terms of training, in terms of retention, in terms of brain drain, mostly because people are demoralized and salaries are not paid on time or they're not paid at all. And I hope this is an issue that will be sorted out eventually by the Ministry of Health. One of the other major concerns for healthcare workers is the insecurity in the various regions of the country. And this has led many to decline to work in specific regions because a few individuals who work in the healthcare sector have actually lost their lives or been harassed by the communities there. And I think that it goes a lot to show that our problem starts from the ground level, and we need to involve the community in these discussions on the fact that healthcare workers, as Dr. Victoria said, have no tribe, they have no religion, and they are tasked with providing services to humanity, and therefore we should allow them to do their work no matter where they come from, no matter who they are, no matter what religions or ideologies they subscribe to. Now, we would have wanted to go deeper into some of the challenges that the Ministry of Health has encountered in terms of service provision, but I believe that Dr. Victoria has mentioned quite a lot of it, and I think it has a lot to do with financing and the fact that the infrastructure generally in South Sudan, because of being a post-conflict region, has not allowed us to be able to extend the reach to the various areas of South Sudan that might be very, very interior. We hope that the Ministry of Health is working on solutions for some of these issues and that the government is focusing on health. We hope that the budget for health is actually increased, because it's quite a sad situation to find that a country with so many people who are experiencing poverty and insecurity is not able to provide healthcare for its citizens adequately. So I would like to thank the audience for joining us today. And we hope that this is a discussion that will continue in the various places where policies can be made and strategies people come up, the Ministry of Health is able to come up with strategies that are able to ensure, with strategies that will ensure that the healthcare sector is developed and we are able to transition from an emergency relief setup to a more sustainable development one. And the Ministry of Health is able to take over most of the responsibilities in providing healthcare to our citizens, and we don't end up in a situation where it becomes a blame game where various partners are blaming each other because of the healthcare sector actually failing in certain areas. So we look forward to having Dr. Victoria again, if possible, to continue this discussion. However, I would like to end this session here, and I'd like to thank the audience for joining us and for contributing in terms of comments and questions. And we will be able to answer some of those questions post the discussion. And we want to thank each and every one of you who has been supporting the South Sudanese Women Intellectuals Forum since its inception, our members, the audience, our various partners, both international and local NGOs. And we are grateful for your support, and we hope to continue discussing issues that affect our country and coming up with solutions for the same. So thank you, and I would like to say goodbye, and we look forward to seeing you once again on one of our sessions, both our regular sessions and our special editions. We look forward to seeing you then. Thank you so much, and goodbye.